Hello, my name is Patrick Charles, and my topic is on schizophrenia. I am an NSC 890 Research and Rural Nursing at Eastern Kentucky University. Schizophrenia is defined as a chronic, severe, debilitating mental illness that affects the way humans perceive reality. This mental disorder is identified when a person presents abnormal social behavior and fails to separate fact from fiction. The most common symptoms include false beliefs, unclear or confused thinking, auditory hallucinations, reduced social engagement, and emotional expression, as well as lack of motivation. Schizophrenia affects approximately 1% of the American population. Typically, the disease manifests in late adolescence or early adulthood. Currently, there is no known single cause of schizophrenia recorded within the medical literature. Admittedly, studies suggest that the genetic factors may be the catalyst for vulnerability to the disease, while environmental factors may significantly contribute to the varying degrees of affliction. However, the aforementioned fails to create an accurate baseline as a predictor of occurrence, nor does it guarantee successful treatment options. Non-adherence to antipsychotic medication is highly prevalent in patients diagnosed with schizophrenia. Consequently, various studies have been conducted to find ways to increase adherence levels. In the last decades, several interventions have been created to improve adherence rates. Recent treatment recommendations promote focusing on specific targets that may contribute to non-adherence. Emil Barkov et al. 2013 describes motivational interviewing as a client-centered direct method for enhancing intrinsic motivation to change by exploring and resolving ambivalence. Traditionally, diagnosis has been determined by a physician's observation of acute psychosis as well as the individual's admission of the affliction. Research has shown that non-adherence to antipsychotic medication in schizophrenia is common in the outpatient practice setting and influences long-term outcomes. Non-adherence is associated with an increased risk of relapse, hospitalization, and suicide. Various factors are associated with adherence. However, non-adherence within the 4 weeks prior to starting a new medication is the strongest predictor of subsequent non-adherence. Additional baseline indicators for future non-adherence include alcohol dependence, substance abuse, hostility, lack of social functioning, living independently, and more severe psychopathology and previous hospitalization in the 6 months prior to baseline examination. Treatments include pharmacotherapy, antipsychotic drugs, drug and psychosocial interventions, motivational interviewing, and compliance therapy. Factors influencing adherence include illness-related variables, treatment-related variables, patient-related variables, and the relationship between physician and patient has also been associated with non-adherence to medication. Case control or cohort studies were examined to understand correlations. The strengths of these study designs were that it provided verifiable predictors for healthcare individuals. The studies were flawed because it only identified certain persons within the group, and the test subjects were not extensive enough to gain enough valuable insight. The literature does not address all possible environments that those afflicted with the disease might be subjected to, nor does it find methods to cure the disease. It only finds methods to deal with it. Adherence levels can be raised by improving patient monitoring, improving patient and staff relationship, combining education with treatment, and offering individual support via groups or via services. The information gleaned from years of research is valuable to the nursing practice because it allows nurses to better understand their patient. Consequently, they will provide better treatment and be less intimidated by the client. Treatment is more proactive and less reactive because it provides a baseline for those diagnosed with the disease. This information allows researchers to create strategies that improve adherence percentages as well as improve patient care. It seems as if the experiences during hospitalization coupled with the factors of the critical period early after discharge appears to affect the likelihood for early rehospitalization. Two potentially modifiable risk factors have been identified, namely, a short duration of the initial hospitalization and early non-adherence to medication after initial discharge. Intensified interventions to assure medication adherence during the transition from the first inpatient treatment to community treatment may reduce the risk of rehospitalization. This concludes my presentation on schizophrenia. Thank you for looking at it.